What if trauma is not stored where we have been looking for it? What if the reason so many people feel stuck in therapy is not resistance or avoidance or not trying hard enough, but because trauma lives below thought, below language, and below memory? Over the last few years, something important has been happening in the trauma field. Researchers, clinicians, and major academic publishers are all pointing in the same direction. Trauma is a sensory and nervous system phenomenon, first and foremost. In fact, one of the most respected trauma neuroscience publishers in the world, the Guilford Press, recently released a major volume called Sensory Pathways to Healing from Trauma. This book was authored by Dr. Ruth Lanius and colleagues, some of the most cited trauma researchers alive today. And at the same time, a newer approach has been gaining attention in clinical circles: Deep Brain Reorienting, or DBR. So we're going to connect these two developments and explore why trauma treatment is shifting toward sensation, orientation, and the deeper layers of the brain. So much ado about talk therapy. So for decades, trauma treatment focused on meaning, memory, and narrative. You tell the story, you understand what happened, change the thoughts. And for many people, that actually helped. But to some, it only helped to a point. But clinicians kept seeing this same thing. Clients who understood their trauma intellectually, clients who could explain it perfectly, and yet their bodies were still reacting as if the danger were happening now. Heart racing, freezing, dissociating, shutting down. And this is where the work of Dr. Ruth Lanius becomes crucial. And in Sensory Pathways to Healing from Trauma, Dr. Lanius and her colleagues make a clear case. Trauma fundamentally disrupts sensory processing and body-brain integration. Not just memory, not just emotion, but how we see, hear, feel, and orient, and experience the world at a basic physiological level. This reframes trauma entirely from something we remember to something we live through our senses. So what exactly are sensory pathways? So, okay, let's slow it down a bit. When something overwhelming happens, the brain does not start with meaning. It starts with orientation. Where is the threat? Do I move toward it? Do I move away? Do I freeze? These resources are governed not by the thinking brain, but by deep subcortical structures, especially the brainstem. According to Sensory Pathways to Healing from Trauma, trauma can fragment how sensory input is processed across systems like vision, hearing, touch, proprioception, which is sense of position, interoception, internal body awareness. When these pathways are disrupted, the nervous system stays partially locked in survival mode, even years later. This is why people can feel unsafe without knowing why triggers don't always make logical sense, why the body reacts faster than thought. And this is the exact level where deep brain reorienting works. So, what is deep brain reorienting, or DBR? Well, it is a trauma therapy developed by Dr. Frank Corrigan, a Scottish physician based in based in Argyll in the United Kingdom. And DBR is grounded in neuroscience and attachment theory. So unlike therapies that begin with memory or emotion, DBR focuses on the very first milliseconds of a trauma response, before fear, before panic, before meaning. DBR tracks the orienting reflex, the subtle muscular and sensory movements that occur when the brain detects threat. These often show up in the eyes, the neck, the jaw, the face, the head turning or pulling away. DBR therapists help clients notice these sensations without pushing into memory or emotion. Why? Because the brainstem initiates survival responses before the cortex even knows what's happening. And according to DBR theory and Dr. Lanius's research, unresolved trauma often reflects an interrupted orienting response, a moment where the nervous system could not complete what it needed to. So how does DBR align with sensory pathways theory? And this is where the Guilford book publication becomes so important. So Dr. Lanius's book does not promote one specific theory, but it strongly appears to support a sensory-based, bottom-up approach. The book emphasizes that healing occurs when sensory systems regain integration and coherence. And DBR fits directly into this framework because it works below narrative, does not require reliving trauma, prioritizes bodily safety, allows the nervous system to complete stalled survival responses. Rather than forcing exposure, DBR allows shock to unwind organically at the level it first entered the system. Many clients report feeling safer, more present, and less reactive, sometimes without dramatic emotional catharsis. That is not avoidance. That is neurophysiology doing its job. So early research on DBR, including randomized controlled trials, shows promising reductions in PTSD symptoms. Some participants no longer met diagnostic criteria after a relatively brief course of treatment. Importantly, these changes often persisted at follow-up. At the same time, Dr. Lanius's body of work consistently shows that trauma involves altered connectivity between the brainstem, limbic system, and cortex. When therapy addresses only the top layers, which are the thoughts and the memories, deeper dysregulation may remain untouched. This does not mean traditional therapies are wrong. It means that they may not go deep enough for everyone. So you might be wondering how DBR compares to EMDR or somatic experiencing. Here's the most prudent way to think about it. EMDR primarily targets memory reconsolidation. Somatic therapies work with body awareness and automatic regulation. DBR specifically targets orienting and shock physiology at the brainstem level. DBR is not a replacement. It's a different entry point. For clients who dissociate, freeze, or feel overwhelmed by memory-based work, DBR may feel safer and more tolerable. This layered approach is exactly why the book by Dr. Lanius argues for matching the intervention to the nervous system's capacity. So trauma is no longer seen as a failure of coping or cognition. And the publication of Dr. Lanius's book perhaps signals a paradigm shift in the treatment of trauma. Trauma in this context is understood as a biological imprint held in perception, orientation, and bodily experience. This reframing reduces shame. It explains why healing is not linear, and it opens the door to approaches like DBR that respect the nervous system's timing. So is deep brain reorienting the future of trauma therapy? It's too early to say if it's the future, but it clearly seems to be part of the path of where this field is going, towards sensation, towards safety, toward the deepest layers of the brain. And please keep in mind that this is not to be taken as mental health advice. It is for educational purposes only. And for more information, visit the Guilford Press. I will post the link to it in the description, as well as the official website for Deep Brain Reorienting.